Today is a very important day for those experiencing addiction and mental health issues here in our province. I first want to just take a moment to acknowledge 3 people who are in the room with me. And it's been quite a little journey since I was first invited to the mental health conversation back in 2019, in late 2019, when the Premier and Minister Fleming invited me to this conversation. And so at that time, Hélène Delange, who's with us today, came with me at Social Development to help work the file. Annie Pellerin, who's the Acting Director of Mental Health Services at the Department of Health, and Mark Wise, who's also here, he's the ADM at Health. This has been quite a journey for all of us as we have strived to continue through our COVID challenges to move this file forward. And I want to thank them all today for all of their input, their passion, and getting us to where we are now. I'm pleased to be here this afternoon to unveil our comprehensive 5-year action plan. I want to personally thank everyone who has helped us get to this day today. The stakeholders, clinicians, clients, their families, and everyone else who has shared their stories. Thank you. For me, this has been a personal journey to get to today over the past 17 months. I clearly recall the day back in September 2019 when Premier Higgs asked me to take on this particular file. At that time, I was serving as Social Development Minister, and I took charge because mental health and addiction was becoming an increasingly prominent area of concern for our community partners and New Brunswickers. The rising level of mental health and addiction was alarming. We held our first roundtable with stakeholders meeting in November of 2019 and held another one in January of 2020 to lay the foundation so that we could all work closely together to formulate this action plan. In August 2020, we campaigned on a promise to deliver a 5-year addiction and mental health plan. In September 2020, when I was appointed Minister of Health, I brought the file across King Street with me. We all continued to roll up our sleeves to ensure we developed an action plan to serve as a framework to guide and align current vision, plans, and priorities, as well as to foster increased collaboration among stakeholders and partners in mental health. As we assembled this plan, we didn't wait. In fact, we moved forward by implementing some measures, such as expanding the mobile crisis services, bringing the Bridge the Gap online, opening a demonstration walk-in service clinic in Campbellton, where their success to date has eliminated their wait list and individuals have seen their needs met with a high level of satisfaction. I want everyone to know that this plan has clear goals and will have regular check-ins to ensure all partners are accountable. This 5-year action plan, overall goals are: improve population health, which will reduce risk factors and improve access to what is needy to be healthy. Improve access, faster first contacts, and reduce wait times for services. Intervene earlier, greater access to prevention and early intervention supports and services. Match individuals to care, easily navigated and more complete continuum of services and supports, and reduce drug-related impacts, communities that are less burdened by the impact of drugs, such as crime, illness, injury, and death. The 12 key priority initiatives over the next 5 years include implementation of walk-in addiction and mental health services across the province, addition of addiction and mental health resources to fill current gaps in staffing and prepare for increased demand from COVID-19, implementation of an education, training, and knowledge transfer plan, Creation of various forms of supportive housing for addiction and mental health clients, including the implementation of a clinical consultation model for individuals requiring out-of-home placement. Implementation of a guiding document for upstream population health promotion and prevention in New Brunswick, including a New Brunswick-specific version of the Icelandic preventative model. Implementation of the Provincial Treatment Center for Youth. Implementation of outpatient withdrawal management services in partnership with primary care, and a review of existing detox beds to determine needs and optimal use. Develop a service model for individuals presenting with neurodevelopmental disorders. Initiations of a psychiatry resource strategy with a focus on recruitment, retention, distribution, and access. Implementation of regional inpatient youth psychiatric care where needed. Expansion of the RCMP Crime Reduction Unit, including resources from the Justice and Public Safety Safer Communities and Neighborhoods Unit, formerly known as SCAN, and implementation of overdose prevention sites. This year alone, 2021, we aim to implement walk-in addictions and mental health services, ensure adequate addiction and mental health staffing and space to fill current gaps, implement education, training, and knowledge plan, the RCMP Crime Reduction Unit expansion, implement overdose prevention sites, and implement guiding document for upstream population health promotion and prevention. In closing, I would like to say that this is an action plan that provides accountability for the provincial resources dedicated to addictions and mental health, with measures to monitor the benefits gained from it. And I've made this commitment with staff. This is not a plan that we will table and then look back in 5 years to see if it worked. We will be continuously assessing our situation, assessing the services that we are providing, and if we have to pivot, if we have to make changes, we will do it in real time. This is an action plan that will get results. Thank you. Merci.
Tom Bateman, Brunswick News.
Good afternoon. Minister, can you detail what you mean by overdose prevention sites? Do you consider them synonymous with safe injection sites? And if not, how do they differ? And can you maybe just describe in general your feelings towards the harm reduction model in this respect? Thank you.
It would be similar, absolutely. The issue will be is that, of course, when you're always working towards harm reduction, it is with a priority to ensure that individuals who are putting drugs into their body are putting in what they think they're putting in. We want to have a safe place for needles to be left behind. This is as much about community safety as it is also outreach. And when we meet individuals where they're at, we're going to have a better potential to engage them in recovery steps that we can assist with and direct them to proper services.
Thank you.
Can I follow up? Or?
When we circle back.
Thank you.
Vicky Hogarth, CHCO.
Mr. Shephard, do you know if there's been an increase in demand for detox centers and addiction services during the pandemic? Has it become more critical at this point in time?
Well, on the whole, we've had an increase of about 16%, if I'm not mistaken, for services, and so we're not meeting even the national benchmark for these services. So that's why we have to engage this part of the program in as timely a fashion as we can. And I think COVID has had an impact overall with regards to our mental health challenges. And so we can't dispute that. We know that after COVID-19, maybe we get to our new normal. There have been serious consequences of COVID-19 in our society with regards to, families not being able to be with loved ones at end of life, families who can't get together. Those needs are real, and there will be consequences to COVID.
Thank you. Callum Smith, Global.
Thanks, Bruce. Minister, in speaking with the Canadian Mental Health Association of New Brunswick, they mentioned the province has always been talking about the economic recovery, but they say that's not going to happen without a healthy workforce, which is obviously a much more imminent need. I guess what's the timeline of some of these key priorities that you're focusing on? I guess I certainly have interest in the walk-in addiction and mental health clinics. What does that look like for a timeline?
So our timeline for a full implementation of the walk-in clinics, I believe, is fall, and we're looking at September, October. COVID, hoping that it doesn't interrupt us too much. But I need to share this story with you on the Campbellton demonstration model. They're probably 8 or 9 weeks in now, but in the first 6 weeks of the Campbellton clinic being open, they received 97 walk-in appointments that were actual walk-in appointments. 94% of those appointments were satisfied in one visit, and follow-up calls showed that there was a high degree of satisfaction with those visits. And the wait list of 37 was eliminated. This is exciting, and I can't wait to get more clinics up and running.
Thank you. Nick Moore, CTV. Nick Moore. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. Ministre Shephard, vous parlez beaucoup de prévention dans votre plan. Je voulais savoir si vous pouviez me donner 1 ou 2 exemples concrets de la façon dont vous allez améliorer la santé de la population en général pour prévenir les problèmes de santé mentale. C'est un peu flou, on dirait, dans le plan, puis j'aimerais avoir, dans le fond, une idée de ce que vous proposez exactement.
Certainly. You can't underestimate the importance of early intervention. So that's first and foremost where I would go with answering that question. We know that if we can access individuals, or if they can access mental health services when they have a lower acuity of need, we have a greater opportunity for success. As I've just mentioned with the Campbellton model, the majority of those 97 walk-in visits were satisfied in one appointment. That's cooking with gas, as far as I'm concerned. Secondly, we need stronger, more resilient communities. And that's what the Icelandic prevention model is going to help us demonstrate. There's an entire process around this, and we're going to be working with communities who really want to do this, who want to change the opportunity for the youth in their community, to ensure that they've got recreational opportunities, to ensure that we're following some best practices with regards to how we respond to their needs on a daily basis. And I think that when, it's really hard to measure this part of it, because it's going to be down the road that we see some of these results. And we know if we can prevent the circumstances of addiction and serious mental health complications, that's going to show further down the road. But I'm very excited that we have injected into this plan earlier intervention models, and that's going to help us a lot.
Thank you. Merci, M. Boudreau. Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. Ma question, c'est au sujet des cliniques sans rendez-vous. Je me demandais quand est-ce qu'elles vont ouvrir, combien en aura-t-il et comment ça va fonctionner concrètement une clinique sans rendez-vous pour la santé mentale?
So the great thing about the walk-in clinics is they can be modified for each community, but we envision 14 of them around the province. We've sort of based that on our community health centers that we have and the resources that we have in some of these areas to build on. So we're looking at 14, but just recently we've also begun conversations with PEDAL and our universities to provide perhaps a walk-in service at our university level as well. So 14 around the province, some others in our universities, and they can be accommodated. You know, one of the things is that this can't just be cookie cutter. So some communities may find that they work really, really well, 8 a.m. till 3 in the afternoon, or noon hour until 8 p.m. Maybe it's 3 p.m. until 11 or midnight. So each community will have the opportunity to assess their needs and to adjust their operation plan accordingly.
Thank you.
And when?
Oh, when? The 14 clinics are to be by fall. We're looking at October is probably our outlying time frame.
Maintenant, Richard, moniteur de l'Acadien.
Merci, Bruce. Ma question pour la ministre, c'est que en décembre 2019, l'Assemblée législative a adopté à l'unanimité une motion voulant la création d'un défenseur des personnes souffrant de maladies mentales. La ministre a participé au débat et je sais que l'engagement a été pris à ce moment-là. Et j'ai été surpris de ne pas voir le poste de défenseur mentionné dans le document. Est-ce que la ministre peut nous donner davantage d'informations là-dessus?
Sure. So that proposal is still ongoing, and I just have to point to our COVID reality that it is still being worked on. In all honesty, I don't see one advocate in the province. I think we have two health authorities and we have many zones. And I think rather than seeing files pile up on someone's desk, I would rather see if we could address things on a local level. So we are in the works for doing that. It's still being constructed. We're still working through some planning with our RHAs, and I can't give you a timeline today, whether it will be in 2 months or 4 months, but it will be soon.
Merci beaucoup, Monsieur Richard. Rachel Cave, CBC.
Yes, please, Bruce, and I will hope you will circle back to the minister, please. The 2024 implementation of a provincial treatment center for youth, does that mean doors open? Is there a location chosen? What is the status of that project, please?
So we put $2 million into our current budget with regards to planning and searching out property for that. I do not believe today we have a property selected, but we're certainly moving in that direction, and the 2024 is what we've targeted as our opening date. Believe me, I've tried to push this one as much as I can, and staff are very tolerant of me as we process forward with this. I do want to make a statement that I try to put into every time I talk about the youth center. I want to talk about not just a center of excellence, but an actual network of excellence throughout our province. And while I realize that we will need a building in a community that will be the nucleus of that leadership, it's really important that we can treat our youth in community where they're closer to family, closer to friends, closer to their schools and places that they know. That's where we're going to have the biggest success in my mind, and I believe that I'll be supported with that with our stakeholders. But this is about a network of excellence, and that is the model by which I'm proceeding.
Thank you. Tom Bateman, Brunswick News.
Oh, hi again. I just have a question about the budget for this. I think we read that initial funding is found within this year's provincial budget. What about future years of plan?
Well, as you know, we have our mental health section of the department that is budgeted. Last year, we had an extra $3 million that was given through to social development to work on the mental health strategy, and that's coming back to the Department of Health, so that money's here. There's also a safe communities component of this, and I'll let Minister Fleming speak to it as it's under the Justice and Public Safety, or I'll just tell you that there's an ask there as well, and I'm confident that we're going to be able to have that supported.
Thank you. Vicky
What's the
Hogarth.
ask for?
Repeat that, Tom.
Oh, I'm sorry. Yeah. What is the ask of Minister Fleming's department?
That'll be for him to disclose to you and for government to come forward with the budget. But I will say that all in all, I think that the overall combination of between our two departments will be roughly $6 million.
Thank you. Vicky Hogarth,
Thank you, Bruce.
CHCO.
Minister Shephard, what will these walk-in addiction and mental health services have to offer a person? And would they potentially have the option of fast-tracking a person to detox or inpatient rehab if necessary?
So that's the intent. It is to get people to services sooner. And so when you say fast track, I don't want to give the illusion that somebody's going to go from one location to another immediately. There may be resources that we can put in place while we're waiting for upcoming treatment centers to have placement. But the goal is that we can be supportive during a time of transition, and as individuals are seeking out that help, we are there at the ready to respond to it.
Thank you. Callum Smith, Global.
Thank you. I guess, Minister, I'm wondering what your thoughts are on the current state of the mental health and addictions care system in the province, and how confident you are that this plan will truly make improvements on the current state of things.
So I think that with resources that people have, people within our system are doing some tremendous work. It's not easy, and the real crux of the services that are needed that I've seen since having the stakeholder engagement and coming to this file is the response time. And so that's why these walk-in clinics are so important. That's why our ability in order to help people through a crisis, that's why the mobile mental health crisis teams are so important, because it's difficult to take someone to an emergency room where they're going to wait for hours to see an attending physician, then they're going to wait to see, a psychiatrist. And so it's a very frustrating process. So if we can meet people where they're at and in community with mental health professionals, we're going to gain a whole lot. And I think that continuous improvement has to be the goal here. We need to be assessing and reassessing ourselves to make sure that we're not only delivering the services we've said we would deliver, but that we're also getting the outcomes we're expecting and that we need for our communities. So I think that we need to not only build on what we have, which was necessary, and I think we need to direct people away from the ER as much as possible. We also need to make sure that we continuously improve.
Thank you. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour. J'ai une question sur un autre sujet. Le député Wayne Long a dit aujourd'hui que Ottawa va retenir 140 000 $ des transferts en santé au Nouveau-Brunswick à cause du fait que le Nouveau-Brunswick ne couvre pas les services d'avortement à l'extérieur des hôpitaux. J'aimerais avoir votre réaction là-dessus, Madame la ministre.
It's $140,000. It's not new news, and Mr. Long is going to beat this drum, and we're proceeding as per our policies that we've had in place.
Jean-Philippe Hughes, Radio-Canada.
Oui, j'ai une question au sujet de la mise en place des sites de prévention des surdoses. Je me demande, est-ce que ce sont des sites d'injection supervisés, parce qu'il n'y en a pas au Nouveau-Brunswick, et sinon, de quoi s'agit-il?
So yes, this we're not looking for. We won't be providing providing replacement drugs at these will be a safe place where, drugs can be tested to ensure that they're not laced with anything more than what the individual is expecting. And, a safe place to leave needles behind and to make it safer for the community. And I think that as it evolves, our intent is that this will be a place where we can meet people where they're at, we can engage with them in conversation, and refer them to more services that could be helpful in a recovery process.
Merci. Monsieur Richard, Damien Richard, as-tu un suivi cet après-midi?
Oui, merci, Bruce. On remarque un nouveau mot dans le titre du plan, du nouveau plan, c'est le mot interministériel. Quel modèle le gouvernement entend mettre en place pour assurer une collaboration entre les ministères? Quels ministères sont impliqués? Comment allez-vous vous assurer que l'information est partagée, que ça se fait d'une façon continue et intégrée?
Thank you for that question. My staff are all smiling at me because they know that I have made the statement time and time again that if the departments won't take the walls down, I will use a sledgehammer. It is so important that this cannot be a Department of Health initiative. We need our partners at the Department of Social Development, Justice and Public Safety, education. We must work the mental health addictions and addictions action plan together. We have a deputy minister steering committee that I chair, and we are constantly going to be assessing how we move forward with this. The Premier has also given me a commitment, and he is holding me accountable for how we proceed. So I am absolutely sure that we will go forward. And I'm looking at my comms guy who's kind of smiling, so I apologize. But we will make this interdepartmental. It cannot be anything less than interdepartmental, and I look forward to that challenge.
Rachel Cave.
Yes, please. The timeline says that expanding the mobile crisis service is in progress, and I'm wondering if the minister could please provide specifics. Where is that happening? Who are the partners? What is the budget?
So thank you for that. So as you know, we've done a project in St. John, but I'm going to back up before we did the project in St. John. The Kodiak RCMP had been working with mobile mental health for a good year and a half before even we did the St. John project, and their numbers showed that it was worth it. I'm going to have to get you the numbers, but there's an MOU with Kodiak RCMP. We did the St. John project with I think about $300,000 a year for 3 years, and when we did that, I actually placed a call to Vitalité, and I said to them, if I give you the same amount of money, what could you do with that money? And they were able to sign an MOU with 5 communities in the northern part of the province. And as you dug a little bit further, we even found that there was an MOU with the RCMP in the Miramichi area and the Miramichi zone. So it's funny how things kind of fall into place, and so we have implemented those for now, and we will get feedback to see how they're doing and check in to see how effective they feel they're being. This is about supporting mental health professionals, supporting law enforcement, but more importantly, it's about supporting the client in our community who needs these services.
Thank you. We have time, so if we can do some rapid fires, we'll do some follow-ups. Tom Bateman.
Hi, guys. I just wonder, I'm hoping you can maybe speak to another department here in that interdepartmental nature. What's happening with the SCAN unit? Is all of its funding going to the RCMP's crime reduction unit, or is there, is SCAN still operating in some capacity?
It is, and that's why we referred this to an expansion, because the safer communities component to this is not only necessary, but we need to bring confidence to our communities that we're not leaving that aside. We have to do this together, so the scan unit will be expanded upon.
Thank you, Minister. Thank you, Mr. Bateman. Vicky Hogarth, a quick one.
Thank you, Bruce. Mr. Shepherd, I'm wondering if the province sought out the first-hand experiences of the healthcare system and recommendations from people in recovery from addiction when coming up with the plan.
Absolutely. We couldn't do this in isolation without having those. We've talked with our, with our public health sector. We've talked with our frontline workers and our mental health teams all across the provinces, and more importantly, we'll continue to do so.
Thank you. Callum Smith, Global.
Thanks, Bruce. Minister, looking for your reaction to the Auditor General's concerns over the lack of oversight for electronic medical registry program.
Well, we concur with the Auditor General, and that's why in 2019 we set ourselves on a path to fix it, and so we're addressing it now, and EMRs will be taken to the public.
Thank you. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, votre plan parle, dans le fond, d'engager plus de gens pour répondre aux besoins de soins en santé mentale, notamment dans la foulée de la COVID-19. J'aimerais savoir quand est-ce que vous allez commencer à embaucher des gens, puis pour quels services spécifiquement, juste.
For this first year in particular, we actually have casual positions that we will make full-time. So finding the individuals isn't going to be that difficult. Now, we do have a shortage of psychologists and psychiatrists in this province, and we have retention and recruitment programs in place for that. But this will be an evolution. It's not a switch, and we're on it.
Merci, M. Boudreau. Jean-Philippe Hughes.
Oui, il y a une question plutôt au sujet du centre, pardonnez-moi, j'oublie le nom précis, le centre provincial de traitement pour jeunes 2024. Vous avez dit qu'il n'y avait toujours pas de site précis qui avait été retenu. Est-ce qu'on vise la construction d'un site, l'achat d'un site préexistant ou d'intégrer ça à des infrastructures qui sont déjà destinées à la santé?
So when the decision was made to relocate from Campbellton to Moncton, we essentially started back not quite at square one, but close. So we've had to have consultations again on the scope and the model, because we knew it didn't need to be as many beds as what it was being proposed in Campbellton, because of my discussion earlier about the network of excellence and trying to keep youth in their community. So we're engaging with our stakeholders right now about the scope and the actual logistics, and decisions will be coming forward and plans, RFPs, I'm sure. So that's why 2024 is our target date, and we've got a little ways to go there.
Merci, M. Hughes. Merci, Ministre. M. Richard, as-tu un suivi?
Oui, une dernière question pour la ministre sur le processus de consultation pour le plan, mais aussi pour le centre d'excellence. Est-ce que les communautés, les membres de familles de personnes qui sont atteintes de maladies mentales sont impliqués dans le processus de consultation? Est-ce que la ministre peut nous donner un peu de détails là-dessus?
So yes, the answer is that we need feedback from everyone in order to have the very best resolutions coming out, to our target date of 2024. And so we are involved with our stakeholders on an everyday basis. Partners for Youth have been at the table with us on a continuous basis. So we need those stakeholders to give us that feedback, and we need families to certainly give us feedback.
Merci, M. Richard. Rachel Cave, do you have a quick one for us?
Just to elaborate on the shortage of psychologists, psychiatrists, does the minister have recruitment targets, per year or on any part of this timeline?
There isn't any specific targets. We have a shortage just like every other province in this country. We're also looking at alternatives to psychologists and psychiatrists with regards to, you know, I need to take a minute here to sort of step back and give you just a rundown of our actual goals. So when I talked earlier about meeting the needs of people when they have lower acuity, the whole purpose of that is so that we can utilize professions such as counseling therapists, you know, social workers to help intervene in those issues earlier so that people don't progress to needs to have a higher acuity of need. And so if we do our job well, we can free up our psychiatrists and our psychologists for patients with more complex needs. So the recruitment and retention is ongoing. It is, we will grab every single one that we can and keep building that momentum, but also bringing in other professionals. As I mentioned, licensed counseling therapists, they're on a path of being able to provide services to the province. And so there's hundreds of those throughout the province speaking both official languages. So it's a resource that we haven't even tapped yet.
Thank you, Ms. Cave. So that concludes today's press conference. Thank you for joining. Voilà la fin de notre conférence de presse. Merci beaucoup.